Awesome, how you doing? My name is Gianni. I'm your student physical therapist today. So what we're doing here is we're just going to look at some tests going on in the hip and then the knee as well, okay? And then throughout these tests, you just let me know if you feel uncomfortable or any pain with any of this stuff, okay? So the first test we're going to do is we're looking at your kneecap mobility or your patella mobility, okay? So this would be something where we test if, let's say, when we're moving your hip and knee back and forth, maybe it was limited in when you're flexing your knee or extending your knee. That could be something that would cause it, or any pain in that kind of area there we would test, that patellofemoral joint area. And then let's say you had a recent surgery, and then we were just kind of looking at just how mobile it was since it hasn't been used a lot. Okay, so what we're doing here is I'm just going to have you nice and relaxed here, and then I'm just going to go side to side, so medial and lateral. Good, that looks good, and then we're going to go up and down. Good. Looks good there. Any pain with that? Okay, good, and then we test bilaterally in a sense. And then with that, we can also go on to something since we're in this position as well. So we're going to look at your leg length discrepancy. So just testing if your legs are equal from a part of your body kind of at the hip area down to your foot. If they're uneven, then that's something maybe that could contribute to some of that hip pain that we're having. Okay. So what I'm going to have you do is I'm going to have you, if you want to bridge up just to get that spine in a neutral position, and then come back down, and then we're just going to go down here. Good. And then it's okay if I touch in this area, just trying to feel for your ASIs right here. So what I'm going to do is I'm just going to test from the bottom of that bone right there, the ASIs, and then I'm going to go down to this bone right here in your foot, the medial malleolus, and then we got 85.5, good, and then same thing here, palpating for that, and then let's see, 85.5, good, and then just relax again. I'm just going to take one more measurement just to make sure. So we're ready here. Good. We got 80, yeah, like 85.25. And then, yeah, 85.5. Good. So that looks good. If it was, over 1 centimeter difference, then we might have an issue where that's maybe contributing to some of that pain that you have in your lower body, your hip or something like that, okay? Thank you. Okay, so this next test, we're gonna be testing just something in the hip, okay? So what I'm gonna do is, with this test, this is gonna test if we have maybe like an impinged hip, so maybe that's kind of rubbing the wrong way, or like when your hip moves, it's kind of creeping in with your femur here, so you have a joint there. And when you rotate or move the femur at all, that hip bone is kind of just like they're rubbing against it, not rolling properly on it. So what we're going to do here is it's called a Scour's test. So it's going to test for like I said, something. So we're doing an intra-articular pathology. So like I said, we could be like an impingement we're looking at. So you just let me know if there's any pain with any of this, okay? So what I'm going to do is I'm going to just flex your leg here, and then I'm going to abduct and then externally rotate here, and then what I'm going to do is I'm going to apply a little pressure downwards, and then I'm going to move your leg in and out kind of in this area, okay? So I'm going to apply pressure downwards and then moving it, internal rotation, abduction, good. How does that feel?
Okay.
Is it okay? Good. Okay. And then we would test both sides for that. Like I said, a positive test would be that reproduction of symptoms there, but that looked good. Next we're going to do is anterior drawer test. So this is going to test, so we're going to see if there is an injury to your ACL. So have you heard of the ACL before? So kind of that, there's a ligament right here on your knee, right underneath your patella, and we're just going to look and see if there's any, if that could be a tear or some instability there that maybe we got to look at further, okay? So what I'm going to do is, usually you would test the good knee first. So let's say this was the good knee and that looked good, and then now we're testing the knee that we may think has an issue. So I'm going to be sitting on her foot to stabilize there. And I'm looking at tibia plateau and then the femoral condyles kind of in that general area there. And then what I'm doing from here is I'm just pulling forward and feeling if there's any laxity in that area. Does that feel okay?
Yeah.
Any pain there?
Nope.
Cool. Does that look good? And then if we want to test it in the medial portion of it, I just rotate your foot out a little bit, and then same thing, feeling in that area and pulling forward. Anything there?
Yeah.
Okay, and then we go internally. Same thing. Yeah, that looks pretty stable there. Good. Awesome. So a positive test would be either that laxity in that area or like those reproduction of symptoms and pain in that area. And then the next test we're going to do is we tested the front portion. Now we're going to test the side of your knee. So that's your MCL. Okay. So same thing. I'm just going to kind of put a little stress on it, and you just let me know if there's any pain with that. Okay. So what I'm going to be doing here is I'm just going to have, we can bend this knee here. So we can have that up there, and then I'm going to stabilize with my hip here, and then what I'm going to do from here is feeling for the medial joint line, and then from here what I'm going to do is I'm just going to apply stress to that area there. Good. Any pain with that?
No.
Okay, and if there's no pain, then I would flex the knee 10 to 15 degrees, and then doing the same thing there. And then I'd feel for any type of laxity, or if she had any reproduction of pain with that. So nothing there, no pain?
No.
Okay, good. And the last one we're going to do, it's the McMurray's test. So with this one I'm kind of be moving your leg a little bit more around. So this is the test for different type of meniscus. So we have the ligaments right there, and there's the meniscus in that area as well, okay? So now we're going to test for that, okay? So what we're going to be doing here is I'm going to test the inside portion of the medial first, and then I'll do the lateral, the outside portion next, okay? So what I'm going to be doing is I'm going to have leg here, and I'm going to rotate your foot outwards, and then I'm going to apply that stress that I was just applying. I'm just going to push while I'm moving your leg, okay? So what we're going to be doing here is I'm just applying that force and then coming down. So there, and then applying that force and coming down. Good. Applying that force and coming down. Any pain with that?
No.
No pain? Good. And then to test for the lateral, just going to be the opposite. So I'm going to twist your toe in, and then when you're coming down, I'm just going to be applying a force now out this way towards me, okay? So we're going to have here, and then down, 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 one more, down. Any pain with that?
No.
Okay, so there would be obviously a reproduction of symptoms if there was an issue with the first one that I did, which would be the inside or the medial meniscus, and then the second one I did, the lateral or outside meniscus. But overall, everything looked good.
Thank you.